What should we do when a calf is born? The first few hours in a calf's life are absolutely critical to their long-term performance in health status and producing. Given the stress on the calf during the birthing process and the shock system of entering the outside world, here are a few things you can do to help. We can help with breathing, colostrum, and navel care. In the first step, breathing. From the beginning, one of the first things you can do is to assist the calf in clearing the mucus covering his mouth and nostrils to help them with their breathing. Hang the calf, lifting them so the head is below the chest, or hanging the calf on a sloped surface to let fluids drain from the lungs. This does not mean to hang upside down the calf. Stimulate the nostrils to make the calf cough or sneeze. Usually, this is done with straw or a gloved fingertip, anything clean, small enough to enter in the nostrils and soft enough that it won't injure or inflame the nose. Christening the calf with cold water over the head or poured into the ear to shock them with the cold and simulate head shakes and coughing to clear fluids from the throat. Kiss of life or aspiration, inflating the lungs by breathing through a soft tube inserted into the nostrils or gas mask placed over the snout. Calf resuscitator in use. Now once our calf has taken their first breaths, whether assisted or not, you may notice their breathing will be heavy and they will be panting. This is because a calf is born with less oxygen in their body than they need. This should not worry you, as their breathing will relax after the first hour. Put the calf in a comfortable position to allow them to breathe easily. Colostrum. Getting adequate amounts of vesting or colostrum as soon as possible is critical to the long-term health of the calf and their long-term performance. The lining of the calf gut is open to absorb immunoglobulins for a short period of the time after birth. 24 hours post-calving, the gut cannot longer absorb immunity from the colostrum, and the calf's immune system is on its own from then on. It is recommended to get 2 liters of colostrum into the calf within the first 2 hours of life, ideally by their own sucking. But unfortunately for us, things don't always go that smoothly. The calf's own mother, this will be most closely match the immunity needed. Navel care. A crucial point in caring of your newborn calf is treatment of the navel. The navel is what connects the calf to the cow during pregnancy. As this is break during the calving process, it leaves a direct route into the calf system open for infections and needs to be taken care of as soon as possible. Ensure the calving pen is clean and dry as possible. Disinfect after every calving and making sure there is dry, deep breathing in your pen can work wonders for reducing risk of infection and increasing the comfort for your cows at the same time. Treat the exposed navel by removing any dirt and applying some disinfectant to the fresh navel. You can eliminate whatever infections might be present to reduce the chance of infections later on. We can use iodine tincture as a combination of the iodine and alcohol presents clean and accelerates the drying of the navel. Monitor your calf. Even with the best practice, there is no way to guarantee your calf won't become infected. Therefore, it is crucial to check the navel regularly during the first 17 days for signs of infections. There are signs of an umbilical hernia and can be caused by painful gut damage in the calf. Other signs to look out for: one swelling of the lower joints on the legs and septicemia, which normally present as a high temperature, pain and lack of appetite. In any of these cases, a long-acting antibiotic might be what is needed, but consult your vet for the best approach. Thank you. What should we do when a calf is born? The first few hours in a calf's life are absolutely critical to their long-term performance in health status and producing.